Now, allow me talk about something that I have faced consultation over throughout this week: pelvic inflammatory disease, or that's commonly known as PID. Even before I proceed, I would like to make a clarification that there is a very big difference between pelvic inflammatory disease and the urinary tract infections. Urinary tract infection, this is an infection that only affects the urinary system, that is the bladder, the kidney, and the ureters. But when we talk of pelvic inflammatory disease, it affects the reproductive organs, that is the ovaries, the fallopian tubes, the cervix, and the uterus as a whole. There are three causative agents that are responsible for this. Number one, we have the Neisseria gonorrhoeae species, we have the Chlamydia trachomatis species, and we also have the Escherichia coli bacteria that is also responsible in causing the pelvic inflammatory disease. What really happens is that when one of these bacteria makes its way through the cervix and then gets to reach the reproductive organs, that's how this pelvic inflammatory disease occurs. When we talk of the Neisseria gonorrhoeae and the Chlamydia species, these are bacteria that can be transmitted sexually. So if it happens one of these bacteria makes its way through the vagina, then it crosses the cervix, and then it makes its way to the cervix, it makes its way to the uterus, it makes its way to the fallopian tubes and the ovaries, then it ends up causing these pelvic inflammatory disease. Then we also have an Escherichia coli, which is a bacteria that can also pave its way through the vagina. When it crosses the cervix and then gets to the uterus, gets to the fallopian tubes and the ovaries, then it can also lead to pelvic inflammatory disease. So these bacteria, apart from the Chlamydia and the gonorrhea species, these E. coli can penetrate the body via different ways. And this can affect you maybe after you have undergone an abortion and the process of manual vacuum aspiration, or the MVA has been performed. Many people also can suffer pelvic inflammatory disease immediately after the spontaneous vertex delivery, or the SVD, the normal delivery. That on the process, the E. coli bacteria gets through the vagina, and then when it reaches these the reproductive organs, then that's how pelvic inflammatory disease sets in. So one thing that I should clarify about the pelvic inflammatory disease is that when these diseases left untreated, it causes some tissues on the some tissues to form some scars, whereby when these scars are formed, they can be filled with an abscess or rather the pus, and then causing more damage, and it can also even lead to infertility. Let me say this, that the presentations of the pelvic inflammatory disease and the presentations of the urinary tract infections, they are so much close that it might be hard for you to differentiate that you're having pelvic inflammatory disease or you are having urinary tract infections. One of the major clinical signs or the clinical symptoms that you are most likely to experience when you have pelvic inflammatory disease, when you have vaginal discharge that is very, very smelly. That one is one of the symptoms that it's accompanied with the pelvic inflammatory disease. During sexual intercourse, you experience some pain, or other people complain of experiencing a lot of pain. That one is also another sign of pelvic inflammatory disease. And number three, classical sign of pelvic inflammatory disease, it's whereby you will experience a lot of pain on your lower abdomen or on the right side of your abdomen. People with a PID, they will also experience a lot of pain as compared to the urinary tract infection, whereby you might experience pain on your both flanks. Another sign of pelvic inflammatory disease it's one by people present with spotting after sex. So anytime you have sex after that, you experience or you notice that you are experiencing some little spots of blood. So that one is also another sign of you are suffering pelvic inflammatory disease. And to make just a clarification is that the intensity of pain in pelvic inflammatory disease is more severe as compared to the urinary tract infection, because most of the time in urinary tract infections people tend to experience pain that is more of like cramps, but when we are talking in pelvic inflammatory disease, people experience some severe pain, especially on the right side of their abdomen. Apart from the classical presentations of the pelvic inflammatory disease, some other people will also present with fevers, some other people will also present with headaches, and some other people will also present with experiencing some itching on the openings of the vagina. Now, having talked about this one, who are the people at risk of getting the pelvic inflammatory disease? If you have maybe performed a manual vacuum aspiration or the MVA, or in other ones, maybe you have had a miscarriage and you have gotten to a procedure where you have to, the blood has to be sucked, then that one you are a candidate of suffering from pelvic inflammatory disease. Another person is maybe after the vaginal delivery and maybe on the process hygiene that was not achieved, then you are also likely to suffer pelvic inflammatory disease with E. coli as the culprit cause of it. Also, another person who is at risk of suffering pelvic inflammatory disease is the person who has multiple sexual partners, or a person who is having sexual intercourse with multiple partners without protections, because one of these multiple sexual partners might be carriers of the pelvic inflammatory disease, and when they come have sex with you without protection, they transmit either the chlamydia or they also transmit the gonorrhea species, then ends causing the pelvic inflammatory disease. Now, having now known all these one, how can we diagnose that we have pelvic inflammatory disease? Pelvic inflammatory disease can only be diagnosed either clinically, or when you give your history, we can easily tell that this person is likely to be suffering from pelvic inflammatory disease, and it's not either yeast infection and it's not urinary tract infection. The number 2 diagnostic criteria, it's by a transvaginal ultrasound, or what we refer to as TVS. The pelvic ultrasound is also another diagnostic technique that we can use to tell maybe this person is suffering pelvic inflammatory disease or it's not suffering pelvic inflammatory disease. Now, what do we see? What do we see when we perform all this ultrasound? Basically, anytime you have ever or you will ever go to a hospital, your ultrasound is done, and then somewhere in the comments or somewhere in the doctor's notes, you realize that there is a free fluid in the pouch of Douglas, or what we call the free fluid in the cul-de-sac, then that one means you are having pelvic inflammatory disease. The complications of this pelvic inflammatory disease when it's left untreated is that it can cause to infertility, it can cause the fallopian tubes blockage, it can also lead to ovarian cysts. It also causes the tissue or the scarring of the reproductive organs tissues, and this condition is also known to cause miscarriages. If by any chance it happens you are pregnant and again you suffer this pelvic inflammatory disease, the chances of your pregnancy to survive, they are usually very minimal. So this one is a very serious condition that needs treatment. Immediately you experience these signs and symptoms that I have mentioned, make sure you seek the medical attention for you to be diagnosed earlier and to get treated earlier. The treatment for this condition usually goes for up to 2 weeks. Stages of treatment that we have stage 1, stage 2, and we also have stage 3 of treatment, whereby the very first stage of treatment is where we can treat you as an outpatient when the pelvic inflammatory disease is not so severe, so we can treat you with oral medications that we'll have to take for a period of 2 weeks. And we usually advise, after now you have completed your 2 weeks treatment regimen, we give you another addition of 1 week. And after an addition of 1 week, we always advise that you go back to the hospital again, get an ultrasound then again, so that we'll confirm that the P.I.D, it's cleared. If maybe if it happens you are married and you are suffering this pelvic inflammatory disease, we always advise when you are almost winding up your treatment, then also make sure that your partner is also gets treated for this, because men plays as carriers of pelvic inflammatory disease. We also advise maybe when you know that you have multiple sexual partners and you need to have sex, then always make sure you are using protections, because if it happens you have multiple sexual partners, you fail to use protections, these people fails to get treated, then there is also a probability of a relapse, or in other ones there is a probability that this infection reoccurs again and you suffer the same disease again. So this one is a very serious condition that needs early interventions and early treatment. This one is a curable disease, but when it's left untreated, it has a high number of complications that are associated with it. When it happens, you have an ultrasound. In most cases, people with the P.I.D tends also to have an ovarian cyst. It's not all of them, but quite a number of people. Anytime you have P.I.D, you will also experience quite a number of people also suffer ovarian cyst, because ovarian cyst is a complication of the pelvic inflammatory disease itself. So that's all about P.I.D, and anytime you experience the symptoms I mentioned, please make sure you go to the hospital, have either transvaginal ultrasound or a pelvic ultrasound done to diagnose that you do not have the pelvic inflammatory disease. Please remember to subscribe, keep on subscribing, remember to share, and also remember to like and leave your comment down there. It keeps us moving. Goodbye.